Thank you very much. When we look at the measles and rubella control and elimination, if you look at the budget speech of this year, already in the budget speech we have talked about measles elimination by 2020, and Government of India is committed to both measles elimination and CRS and rubella control. If you look at the Southeast Asia region goals, that's in line with the commitment that Government of India has made, and that's measles elimination and rubella and CRS control by 2020. I will not get into this slide. I think some previous speakers has talked much about it. So this gives you a step ladder pattern of the measles vaccine introduction scaled up, surveillance system established in 2005 as lab-supported surveillance, and that lab-supported surveillance has further been scaled up by 2012, and the sensitivity also has been increased as a outbreak definition from 5 cases over a period of 28 days, over a period of 7 days to 28 days, and now we are also looking at the discard cases as a part of lab sensitivity. When we look at the measles rubella vaccine introduction, so we have a National Technical Advisory Group on immunization. This is a technical body at the national level where I would say the technical, including the partners, are representing, and that's where it has been decided to introduce the measles rubella vaccine. And the strategy that has been approved is a wide age group campaign covering children from 9 months to less than 15 years, followed by 2 doses in the routine. And we have carried out this campaign in the 5 states of Karnataka, Tamil Nadu, Puducherry, Goa and Lakshadweep, starting from February 2017. Basically, the strategy that we look at in terms of measles rubella campaign is the wide age group, which is an injectable campaign. And when you look at this particular campaign and compare with polio, it's almost 3 times the target that we are looking at. And during the campaign, it's a 4 weeks, at least 4 to 5 weeks campaign, followed by a 1 week sweeping activity where you go back to those areas where you have done the campaign and look for any suboptimal coverage in any of those pockets, and you do a sweeping activity. The campaign usually starts from the school, as we have the almost 65 to 70% of the target groups are school-going children, and therefore the first weeks are targeted in the school, subsequent weeks are targeted into the community. And when we talk about the community, we also talk about the communities which are far-flung, where you need to approach either through mobile clinics or any other special approach. So they all become a part of the community activity. Along with that, we look at during the campaign period, the bigger hospitals where there are large number of children coming over in a routine manner are the areas where they have to continuously provide MR vaccine during the campaign period, and they don't function. But the other places where we are looking at a particular village, basically what we look at that they follow one team, one day. So when we look at the activities, it is a large human resource, it's a large cold chain requirement that we are looking at. And when we are looking the experience of such a large campaign, we carried out such campaign in 2010, 2013. That's where we divided the country into 2 groups. One where through the surveillance data and we have seen that the first dose coverage was more than 80%. Those are in the green color. That's the area where straight away introduced 2 doses of measles, first between 9 to 12 and second between 16 to 24 months. But those states which are in the red color are the states which had less than 80% evaluated coverage of first dose of measles. These are the states where we have introduced a wide age group campaign between 2010 to 13, and the group that we selected was 9 months to 10 years, and almost 12 crore children were vaccinated. And immediately after this campaign, the 2 doses were scaled nationwide, and therefore if you look at 2 doses of measles vaccine as a part of the national program, it has been from 2014. That's the period when the entire country has been providing 2 doses of measles. And the basic, I would say from 2010 was the period when we started the 2 doses measles, and 2014 was, it's the entire country when we had 2 doses. When we are looking at the present MR campaign strategy, I would look at 5 states where we have already completed the campaign. There is another 8 states which are in the blue color are the states where we are planning for the campaign. Starting from August till September, October is the period these states will start these campaign activity. It's almost 3.43 crores children we targeted in February, another 3.59 crores children we are targeting in this August. We will be left over with almost 33.7 crores children, almost total 41 crores children will be targeted across the country by December 2018. The campaign was launched from Bangalore on 5th of February 2017. We had the highest political involvement. When we look at the preparedness activity, all the states were informed officially that they are doing the campaigns. There are 12 line ministries who has also been informed about the campaigns and their supports, and they have extended the support. These are the Home Ministry, the Human Resource, where you have the school, elementary schools and others. You have the WCD, Defense, Information and Broadcasting, Urban Development, Railway Board, Ministry of Panchayati Raj, Road Transport, Civil Aviation, Shipping, and Youth Affairs. All these ministry not only has been informed, they have also informed us that they are actively participating in this campaign. We also are getting support from the strategic partners and professional bodies and NGOs, the WHO, the UNICEF, IAP, IMA, IAPSM, IAPHA, and IRCs and Lions Club. We have different levels of program oversight at the national level, at the state level and district level. And at the national level, we have the IAG, the national and international experts, which looks into these surveillance data and decides on the course of the action that we need to take on MR campaign. We have interministerial committees where we look at the convergence of the various ministries and their support. And then we have National Task Force on Measles Rubella, which looks into the day-to-day activities, and National Core Group on Operational and Communications. At the state level, we have State Steering Committee, the State Task Force on Immunization, the State Operational Group. So they are looking at the different levels of activity at the state, and similarly we have different committees at the district levels. When we are looking at the trainings of the different levels of people, that they are either working at different levels or with different ministries like WCD, like education departments, the schools, and etc. So they are all working, and so we have different types of trainings, the planning training, the media training workshop, the micro planning training workshop, both at the rural and urban area of the country, or the orientation on the AFI management and block and sub-level, sub-block level micro planning, sensitization of different levels of people. So when we look at the coordination, it's the inter-departmental coordination been formed at the different levels within the state and at the national level. During the campaign, regular evening meetings are held, and feedback, correction, sensitization, and involvement of professional bodies like IMA, IAP, etc., and then development of HR by WHO, UNICEF, UNDP. They are all there in the field and coordinating the entire activity. And advocacies are also there specifically with the WCD, with the schools, and with the Panchayati Raj. When we look at the program, we have also, what we have done it is, after the micro-plan preparations, we do a preparedness assessment and look into whether they are fully prepared. For the current 8 states, we have conducted the preparedness assessment of 6, and we plan to do a preparedness assessment of Kerala and Uttarakhand subsequently. For the previous 5 states, we already did such kind of preparedness assessment in Karnataka and also in Tamil Nadu. when we are looking at the preparedness assessment in the pre-campaign visit, we look into in terms of the accountability, and we have seen that after the preparedness assessment, there has been an improvement in the accountability at different levels, sensitization of the education department, or engagement of schools, or communication plans, or injection safety and AFI managements. We have seen and that there has been an improvement before the preparedness. There were a lot of areas that these needed to be toned up. What we have done is we have tried to monitor the activities, and specifically this is the line bar which I am showing it for the 5 states where we have looked into how they achieved, and these are daily percentage achievement over the target that they have to achieve. And considering 100% as their target, and if we look at the state like Goa, which is a blue color, in fact, by the time it was almost 2 weeks, they were almost moving up to 80-85%. But when you look at a state like Tamil Nadu, it actually took 20, almost 4 weeks, and they were hovering at 50-60%. And that clearly shows that when we came for the MR campaign, we thought that all these states would be a cakewalk, and simply the coverage would move up in 2 to 3 weeks time, and by the time it is 3rd to 4th week, we will be able to achieve 100%. But then there was lots of, I would say, the activities which went in through the WhatsApp, through the other social medias, and people were having all kinds of informations which created a big, I would say, issues around the coverage, and we had to struggle over here. When we look at the Karnataka and Tamil Nadu specifically, I'm talking about these 2 states because their target children were almost the same. And if you will see Karnataka, which is in the red color, it also initially had an hiccups. But then, because it actually addressed to all these social media activities, and it could pull up to almost 95%, but Tamil Nadu actually almost by 3rd to 4 weeks was able to pick up. It has not shown the last 2 weeks data. But in the last 2 weeks after March, the states has all gone up. And in fact, by the end of the campaign, these states were able to achieve more than 95%, except for Lakshadweep, where data has not yet come in. So we are still waiting for the data. But if we look at in terms of number, it's only 16,000 children there, and 12,000 children has already been vaccinated. Rest all states has pulled up a lot. Puducherry initially, again, I would say on the second day, they had a scare of AEFI where almost 33 children was admitted. And it was nothing but, I would say, when the children was vaccinated in one particular school, and when the other children had seen it, they had a vasovagal attack, and all these children were suddenly was rushed to the hospital. And because the next day there was a news saying that 33 children got admitted, immediately this had an impact of campaign both in Tamil Nadu and in Puducherry. And Puducherry, they were struggling even till the end. So it's very, very important that we have to see all these media campaigns and media activities that does not affect our MR campaign. And these are some of the monitoring data which looks at the sessions being planned, or the IC being visible at the session sites, or vaccines has been reconstituted one at a time, and not they have reconstituted all vaccines and then waiting for the children, because they will lead to AFI, or the complete diluent are being used, or vaccinators are following the correct routes, or they are having the waste proper disposal, or team is having AFI kits. So if you will see that most of these parameters were quite, I would say, up to mark when it comes to monitoring of the sessions at the different states. And even we have tried to look into those children during the campaign period. Subsequently, some of these children has been vaccinated, but those children who could not be vaccinated during the rapid convenience assessment surveys, what we do it is we have people as a surveyor move into the field, move into community, and try to understand why these children has not got vaccinations. And you will see that a large chunk was lack of awareness, or the child was sick. So that's the group which was coming up, and then a good chunk in the Tamil Nadu was showing an apprehension of AEFI as a reason for not getting the vaccinations. So these are the field data that we have collected, and so we have tried to address all these issues during the campaign so that subsequently these could be addressed too. When we look at the Karnataka experience there, because of those initial part of the negative media and others, so schools were not willing to participate and coming forward. And as a result, there was a joint statement by the health and the education minister on third and fourth day and made an appeal, and this has led to a stronger partnership. And then also the Lions Club involvement has actually made those differences that you could see in the initial part when I showed that Karnataka could take away with those negative media, but Tamil Nadu was facing problems. Karnataka had actually made a very aggressive IEC approach, so it appealed to the Chief Minister, appeal came into the newspaper for children to be vaccinated. The Health Minister also made appeals and it came out in different newspaper. Also the Waqf Board and Urdu made an appeal, and its Principal Secretary was champion in regular post on the Facebook. So it was not only the usual newspaper, but Facebook, WhatsApp, and all those things were actually been flooded in Karnataka immediately on second or third day when they found that such a negative media was coming up. And these are the different, I would say, the radio awareness or TV awareness, the panel discussions. So these all were held in Karnataka. And then if you see it in the trains in Karnataka, usually they don't have any advertisement. So they have put in advertisement in trains. They have you could see in the milk part, they have put it on those polypacks, the advertisement for the MR campaign. So they were actually looking at the different medias to educate people in Karnataka. And that was the reason why that in the initial part, the Karnataka had hiccup, but they could pick it up. But similar activities was not seen in Tamil Nadu, and therefore they couldn't pick up. So this is been appeal been given by one of the leading pediatricians in the Karnataka. But when we look at the Tamil Nadu experience, they had regular meetings. The Honorable Minister made an appeal to the doctors. There was a letters from Chief Secretary to the Deputy Collectors and District Magistrate was sensitized. The WCD and Education Department was asked for a convergence and IEC material was developed in the local language. And these things came little later as compared to the Karnataka when we see. Rumors affected the ongoing campaign in Tamil Nadu, and countermeasures were taken, like complaint with the cyber crime police and Tamil Nadu medical councils and child right. They actually put in those that if anyone will make such negative thing, they will be arrested or put behind bars. So they made those complaints, warning through visual and print media, all radio jingles was there. Lions Club message to schools managers for convergence of school into supporting the MR campaign, and parent, teacher and headmasters meeting by district collectors and media, and IAP presence in all advocacy meetings. So these all happened by third or fourth week actually. That's where you could see that Tamil Nadu had actually slowed initial part. These are some of the drawings by school children on their notice board to create awareness in the schools on MR. There's some of the activities that has been carried out by Lions. Lions are very aggressively supporting us into these campaigns. They have already run in 5 states and they are also into the remaining 8 states. They are supporting us. So negative and false message on social media started on second and third day of the campaign itself. False reporting of AFI affected the coverage specifically in Tamil Nadu and Puducherry, and suboptimal participation of school principals and varied involvement of private practitioners and IAP. These were the big challenges that we faced during the first phase of our MR campaign in the 5 states, and more pronounced in Tamil Nadu and Puducherry. The steps taken by the state government was to intensify review of the campaign activity at the appropriate level. There was press briefing, the stakeholders brought together with briefing with the IAP spokesman and focused ISC from school and media handlers. And at the national level, what we did it is we had to aggressively follow it up with the HRD ministry. And there we realized that there are different sections within the HRD ministry which handles the different education system. And this was followed by several letters. One letter when used circulars to Kendriya Vidyalaya and Narvoliya Vidyalaya schools. So this was a different sections. Then CVSC and then letters issued by the HRD ministry. So there were 3 to 4 letters being issued which were under the central control, because when we were looking at it, the Kendriya Vidyalaya, the CVSC, the Narvoliya Vidyalaya does not listen to the state health minister or state education ministers, and there was convergence was not coming so clearly. So we had to work at the national level with the national ministries and issue necessary circulars, so that at the end of the day, each one within the state participates. So we also, because of these media activity, we also had to put up the frequently asked questions, not only in the ministry's website, but also in the WHO's website, to clear doubts on many of the people who were raising questions on the quality of the vaccines, who were raising questions on why vaccinate again. So these were some of the things that we had to put it up, telling people that they should come and get the vaccinations. So we also continued with interviews with the media, both at the national and local level, to dispel the myths that was there. We have also had short audio video clips on expert pediatricians and opinion leaders, and made and circulated in the social media and opinion articles in newspaper and TV and panel discussions. So these were the different modes that we were struggling with in the 5 states, because when we started in the 5 states, we thought that it's a walkover and we will simply have an MR campaign and we will be able to come back. But then on the 2nd, 3rd day onward, we realized that it's not that easy. So the polio NIDs were rescheduled during the MR campaigns because of the fact that they were falling on that day. So we made all those adjustments, and also there was an extensive MR activities to achieve the target that we were looking at. We reviewed the campaign coverage. We have taken those feedbacks to the state. So to sum up, I would say that when we look at the campaign, we look at that partner support, specifically the WHOs and the UNICEF at the field level, are very, very critical for us to see that it is a good coverage, and there's special strategies are needed for the schools for their coverage, and then more intense involvement of underserved community, specifically because that's the corner from where we were getting lots of resistance, and stronger involvement of private setup, and need to bust the myths through a proactive approach, and revise campaign communication material developed on more focused approach targeting. And in the 8 states, we have already revised those new communication strategies, and timely sensitization of press and electronic media. These are some of the newer resource material that we have developed for the upcoming campaigns. We have specifically different materials for the different target groups, for the parents, for the schools, for the frontline workers. So these are materials which we have already trying to put it on different channels, YouTube, Facebook, websites, apart from these regular media channels, because that's the MR campaign actually taught us that our regular media really does not work like TV, radio, newspaper. So you have to look at the different media, and that's the media which was being used by the community. So we plan for involvement of IAP, IMA representative at the state training workshop, the human resource deployment from the partners and UNICEF, interministerial meeting and convergence much stronger at the national level and at the state level, and media roundtable planned for the group of states and various channels for IC on newspaper, dailies and magazines. In summary, MR campaign started in 5 states, and we have been able to achieve 97% coverage, but learning of first phase campaign must be utilized for the second phase that we are planning for 8 and subsequently. Thank you very much.